There are 500,000 people in the United States that could be of risk of 9/11 illnesses, 500,000 people, and they don't know. We are here today to connect the dots. That is why we are here. The government did the right thing, but all I can say is, if I owed money to the IRS, they would find me. And ultimately, I want this government to find all 500,000 people and tell all of you what you're entitled to. The money is there, the help is there. But at the moment, we have to connect the dots. We have to spread the word. We have to be vigilant with our health. And that's why we're here. All right. I'd like to introduce our first panelist, Ellie Engler, a 9/11 civilian director of staff at the United Federation of Teachers. And thank you, UFT, for hosting us.
Good afternoon, everybody, and welcome to our Union Hall. I've been working for the United Federation of Teachers for many years. I started as an industrial hygienist, which means that I went in and inspected buildings to see if they were safe. Asbestos, lead, PCBs, things like that. During 9/11, what happened, and I, along with two other people who were on my team from the UFT, began inspecting, along with the Board of Education and city people, going through each one of the buildings, making sure that they were cleaned properly and ready for occupancy. First one to open was in October. Big mistake. October, Stuyvesant High School. Not a good idea, but they opened it. It was clean. It was clean in the building, but once you opened the doors, the smells, the air, whatever it was, came in. And I'm pissed because we were all told it was safe. And time went on, life went on, and lo and behold, I developed breast cancer. And I had my chemo, I'm fine, go back to work. And it was about 4 years ago that I was meeting with a group of people. I said, I did a lot of work around 9/11. And before that, I had talked about the fact that I had breast cancer. And I was asked to apply for the Victim Compensation Fund. I said, why? Why would I do that? You just talked about connecting the dots. I'm trained as an engineer. I'm an industrial hygienist. I inspect buildings all the time, but it never occurred to me that the cancer that I developed was most likely caused by the work that I did. So connect the dots, take care of yourselves, and if you were down here during 9/11, you need to pay attention and apply.
We have a video presentation for you now.
The idea that you can only give them 5 more years of the VCF because you're not quite sure what's going to happen 5 years from now. Well, I can tell you, I'm pretty sure what's going to happen 5 years from now. More of these men and women are going to get sick and they are going to die.
That was Jon Stewart addressing Congress in 2019, advocating for an extension to the September 11th Victims' Compensation Fund, which was due to run out of money. Later that year, Congress passed the 9/11 Victim Compensation Bill to permanently replenish the fund. Now the Justice Department is out with a new report showing more people are believed to have died from illness related to 9/11 than from the attacks themselves. And Rupa Bhattacharya, the special master tasked with administering that fund. Does anything stand out to you?
So I think a couple of things stand out to us. One of the things, of course, is that, as your sort of lead said, we now have almost 3,900 claims from people who are alleged to have passed away as a result of their 9/11 related illnesses, which does mean that we are now passing the point where we have more people who have died subsequent to 9/11 than died on 9/11, which is really a sobering fact. about 48% of our claimants who are found eligible have cancer conditions as one of their conditions. And we've seen that number sort of slightly increase over the last few years. So that's something that we've been paying quite a bit of attention to. And given that there are latency periods associated with cancers where they don't manifest for some time after exposure, we expect to see more. First responders and survivors are covered for respiratory illnesses that are tied to 9/11. And so we rely upon our sister program, which is the World Trade Center Health Program, to certify conditions as 9/11 related, and then we compensate for those conditions. I think the thing that has affected me the most is just seeing day to day how much the events of 9/11, which as we know changed all of our lives, has really impacted this community, the 9/11 community. And it's, obviously it's the heroes who are the first responders, but it's also the people who just lived, worked, went to school in the affected areas of New York City and were exposed to that dust cloud, who now have cancer conditions or respiratory conditions that are associated with that exposure. We're seeing more and more claims come in from people who just live down there. And it's really, really startling to see.
Our next speaker is Tom Milana. He is the founder of ManCave Health. I want to hear all about ManCave Health and what brought you here to the 9/11 healthcare.
48 years old, I was diagnosed with prostate cancer, and a simple blood test, I say, saved my life. 2 years later, we formed a public charity called ManCave Health. And the main mission of ManCave Health is to raise money to promote men's health awareness and to raise money to sponsor events like today. So if anyone has any information on the charity, wants to get on our mailing list, one thing we do provide now, it's one good thing that came out of COVID, was our virtual support groups that we do twice a month. So if anybody in this room has had prostate cancer and wants to get on a Zoom with 25 to 50 men on a bi-weekly basis and talk about their issues and ask questions to some of our guests, we welcome you to give us your email address, and we'll put you on our list, and hope you can join us for one or two of them.
Okay, John Field, the man I call the pit bull, the man who has been one of the biggest advocates for the 9/11 community. I tell John Field, and he started the Feel Good Foundation to help those who were suffering before anyone was helping with these 9/11 illnesses. He jumped in. John, would you come up here?
Thank you, Shelley. Back in 2015, when we passed the bill the second time, it was for healthcare, extended till 2090. 4 years later, we got the VCF extended till 2090. But it's the healthcare that was dear to my heart. It was the healthcare that was more important to me than money. This is a simple process of getting in a program, a free program that you're all entitled to if you lived, worked, went to school in Lower Manhattan. I can't say this enough. This frustrates me. 300 trips to DC in 17 years, 2,000 meetings, 187 funerals. This is a program that is free for everyone. You're not taking money away from a 9/11 hero. Free healthcare. That is your prescriptions paid for. Your medications, your surgeries. So you're not sick. But you get in the program and you take a yearly physical. You protect yourself for when you do get sick in the future. And I don't want to be a Debbie Downer, but you're at a 60% higher risk chance of getting cancer. That sucks. You're going to live with that feeling the rest of your life, or looking over your shoulder, or when you're going to get cancer. So you're here today, you're halfway there. You're halfway there getting into the program. You do the right thing. Get in the program.
Richie Alley's retired deputy chief. He considers himself lucky because he only had skin cancer. So Richie, can you please tell your story?
So my background actually in the fire department, was a battalion chief at the time of 9/11. So spent the better part of 9 months in and out of that toxic dump. My Last 9 years of my career in the fire department, I represented the fire officers in the union as the legislative and political director, and one of the original lobbyists in getting the law passed countless times with John Field and his crew representing my members. It accomplished getting the law passed, but it gave the perception to the over 300,000 other people that were exposed, the forgotten community, the survivors. They think it's for first responders, and the rest have no clue. So I really didn't come to grips with this until I began working for Michael Barasch at Barasch McGarry and realized, you know how many people in the survivor community have registered for the World Trade Center Health Program? 7.5% of that population. So I applaud each and every one of you for being here. Enroll in the World Trade Center Health Program. Your life depends on it, and your family depends on it. Don't be a statistic.
Lee London is a partner or managing attorney for the 9/11 Victim Compensation Fund practice with Barasch McGarry. Tell us exactly what you do in your job.
One of the major items that we always speak about, number one, don't miss your annual checkups. COVID forced a lot of our clients, and I'm sure a lot of everybody in the community, to miss in-person appointments for skin checks, different types of exams. That's why we're encouraging you to keep going. Don't be afraid to see the doctor. So many of my clients don't want to hear that news, but you're in the 9/11 community. You need to face what's coming. And the only way to face it is have the tools and the benefits of these programs to do it. You're not alone, and the 9/11 community is strong, and that's what we want to make sure everybody understands. There's not enough outreach to the survivor community, and that's why we're here, just to educate. If you have a question about your specific diagnosis, speak to a doctor. If you have any questions about certain presence documents, the law, policy updates, that's where we come into play. So the map, the 9/11 community ranges from people that were below Canal Street at the time, for the Victim Compensation Fund below Canal Street in Lower Manhattan, the Staten Island landfill, the morgue, and if you were any responders and so forth from the Pentagon. But what I find is that a lot of people will say, oh, I knew somebody on 9/11 that was impacted by it. Then do that extra effort to make sure that they know that these benefits are available to them.
Ken, I appreciate you're here to tell your story today. Please tell us a little bit about yourself, what your 9/11 story is, and what you're so passionate about today.
I worked in government for 21 years, and I was one of the survivors who refused to sign up for any of the programs because I truly believed they were for the firemen. Then in 2015, I was at work and I collapsed. I was brought to the ER, and I was immediately diagnosed with stage 3 kidney cancer and lost my left kidney and a few other things. For all the years that I refused to sign a paper about any of the programs, my brother-in-law, who was a police officer, kept on telling me to sign up, and I refused. Well, guess who showed up in the hospital and threw all the papers on my lap? He said, now you have to sign up. And I did. Since then, it's been 5 years, and I'm still cancer-free. And I say that because I'm blessed in many ways. Listen to this advice. If you're here and you haven't signed up in the health program, it doesn't cost a penny. Sign up, because if you get sick a year from now or 10 years from now, it's only going to get harder and harder to get the paperwork done. And you don't want to leave that to somebody else when you're sick. You don't want to leave that to somebody else to try to do that for you.
Thank you.
Lila Nordstrom is a 9/11 advocate. Lila was a student at Stuyvesant, and what she experienced affected her health. So Lila, come and tell your story and share that with us, please.
So my name is Lila Nordstrom. I founded an organization called Stuyvesant Health that does outreach and advocacy work for the youngest 9/11 survivors, which is people that were in the schools and were children on 9/11 in the aftermath of the attacks. So we returned back to school on October 9th. That's less than a month after the attacks. that's in the middle of the cleanup effort. The fires at Ground Zero did not stop burning until the end of January. And school children, ultimately 19,000 public school children, as well as private school children, children who were not yet at school age, college age children, or college age adults, we all came back to school at the behest of the federal government at a time that we now know wasn't safe. And so we have faced, some of the exposures that people who lived and worked in the area also faced. And we did that before we were old enough to vote, before we were old enough to make any decisions about where we should be. And because of that, we also qualify for care in the World Trade Center Health Program. I would encourage anyone who is a part of the survivor community to try to let go of some of the narratives around sort of heroes versus just bystanders, and just give themselves permission to feel that they deserve these resources and should absolutely have access to them. We were all wronged and we were all wronged by the federal government. So we were all wronged by the same source. The programs are predicated on the misinformation that the EPA gave after 9/11. They are not predicated on the fact that a terrorist attack occurred in the first place. So we have just as much a right to these programs as responders, as emergency workers, as anyone else, and we should feel that we're entitled to take advantage of them.
Thank you for having me here today. My relationship with Barasch McGarry came about when they came out to Staten Island to visit with the local support group that my husband and I started about 13 years ago. We, as you know, Staten Island, forgotten borough, as they call us. Well, guess what, folks? Many islanders lost their lives in 9/11, and many of them are still very sick. In fact, our local support group, we have a couple of members that have qualified for the fund. Multiple myeloma is a very quiet disease. A lot of people don't know much about it. When my husband got that disease, we had never heard of it. The only person that we knew who ever had it was Geraldine Ferraro, the congresswoman, and she has since died of multiple myeloma. It is a blood cancer in the family with leukemia and lymphoma, just so that you know. And I just want to alert you to some of the symptoms, because many of the people who were down here after 9/11 may have multiple myeloma. It may be in a smoldering stage, and you may not realize that you have it. And there are 4 symptoms that are very obvious that you should know about. They're called crab symptoms. C, the calcium in your blood, high level of calcium. R, for renal problems. A, for anemia. And B, for bone pain. Bone pain probably being the biggest. If you have any kind of back pain, you should always check it out. And as said earlier today, early diagnosis is key. Now, many people don't like support groups. They don't like to come. They don't want to talk. They don't want to share. But let me tell you this, it's one of the most valuable things you can do. And I don't care what illness you have, but I can assure you that every illness has a foundation. We share stories, we learn things, and we become like a really big family. I also want to add a little story that I want to tell you today about my husband's sister, Maureen. Maureen traveled downtown Manhattan working after 9/11. She took the ferry over and she traveled through the area. Well, guess where she is today? She's at the Mayo Clinic. She had a double lung transplant 30 days ago. And she also had, by the way, skin cancer. So when she first told me about this, I said, Maureen, you were down there, you walked through that area for months. And she actually had to get 2 witnesses. And one of the gentlemen that she traveled with, guess what? He has leukemia and he never filed a claim. So she got him to file a claim as well. So we meet, the Staten Island Multiple Myeloma Group, we meet once a month on the second Wednesday of each month. Because my most important message is learn to read your blood work. Thank you for coming today.
Thank you so much. Michael Barasch, when he first started his practice, he was basically representing FDNYers who were injured on the job and did a great job doing that. But his office is steps from the World Trade Center. In his office alone, I believe this figure is correct, 40% of those who worked for Michael at the time of 9/11 came down with a cancer, and 2 people died. Still, thousands of people not connecting the dots. Michael Barasch, tell us why this is so personal to you and your own cancer story.
Let's start with the short video and then that'll kind of set the table.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
It's also critical that we reach our students and our staff members, our teachers who were in the schools 18 years ago.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
Our law firm now represents over 25,000 people in the 9/11 community.
And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
We're here today to talk about the health program. That is the common theme, the fact that only 7.5% of the non-responders have enrolled so far. It is heartbreaking to have gotten Congress. Listen, the federal government screwed up big time when they allowed the EPA to say the air was safe. Those of you who were down here, does everybody remember that? Well, look, let's face reality. They wanted to reopen Wall Street. And we were the sacrificial lambs. You know, we weren't as important as the Dow Jones. But the Congress did the right thing in 2010 when they passed the James Zadroga Health and Compensation Act. Now, you've all heard it's 2 separate programs, and just because you're registered in one doesn't mean you're registered in the other. But I'm not here to scare you. I think everybody else is pretty much sober, everybody here. But we were honored to represent Detective Zadroga. Jimmy died at age 34 of pulmonary fibrosis. It's an insidious lung illness. They did an autopsy, and in his lung tissue, they found ground glass, asbestos, chromium, lead, benzene. These are all known carcinogens. And as I just can't help but not think, if he had it in his lung tissue, we all have it in ours. We're just lucky that we're still here 20 years later. Can you believe it? 20 years. So that's why we're urging all of you. Early detection, that's the key. Skin cancer checkups every year. And please get into this health program. As John Stewart says, access what you are entitled to. One great thing about the Victim Compensation Fund is you never waive your rights. So many people have said, oh, I only have GERD, I only have sleep apnea. I want to wait until I get really sick. Please do yourself a favor and sign up for the health program now. There are special circumstances where where the VCF will expedite your claim. I can't tell you what a wonderful feeling it is for us to help someone and tell them they're going to get compensated so their kids won't lose their home, so their kids could go to college, their wife or their husband's going to be taken care of. I mean, they want to help you. The Victim Compensation Fund, it's not an adversarial situation at all. They want to find you eligible, but you need to help them by showing some proof. So what should you do now? Well, this is going to shock a lot of you, but I want to make sure you know it. You don't need a lawyer. Go to the World Trade Center Health Program, to their website, and you can register yourself. Go to the Victim Compensation Fund website. Register yourself. If you can do it, great. You save yourself a 10% legal fee. If on the other hand, you feel that it's overwhelming or you need help because it's confusing, there are other lawyers besides us. You don't have to hire us, but I hope you see the passion that we feel. So do some other firms. Secure your evidence now. Again, as Richie Alley said, see a dermatologist every year. So many women, by the way, we've been told this, missed their annual mammogram appointment because of COVID. They thought, oh, it's not that important. I don't want to go out and get it done. Don't do that. If you're a man, as Tom Milana said, go for your annual prostate exam. Get a will done. Choose your beneficiaries. Choose your guardians. Choose your executors so that it's not left up to some strange judge who doesn't know really what you want. And finally, at the end, spread the word to everybody. You all know neighbors, former coworkers who aren't here right now. I'm going to end by letting Rupa Bhattacharya, the special master of the Victim Compensation Fund. Many of you had heard of this deadline of July 29th. That deadline pertained to just a small subsection of people in the 9/11 community. I'd like you to hear hers for 1 minute plea to the 9/11 community, and then we're going to close.
Hi, my name is Rupa Bhattacharya, and I'm the Special Master for the VCF. Our July 29th, 2021 deadline has passed, but I know that there are still a lot of questions about what happens now. So I'm here to tell you that my advice to you is the same as it has always been. If you are there, register. It may be that you're already registered. It may be that the July 29th deadline didn't apply to you. It may be that you will be certified in the future with a 9/11 related condition that will make your registration timely. It may be that there are extenuating circumstances that will let me find you to be timely, even if you're technically late. I can't answer those questions now, but what I can tell you is that the only way to be eligible for VCF compensation is to register. You don't have to be sick. You don't have to be diagnosed or certified with a 9/11 related condition. You can register online at www.vcf.gov, or you can do it by calling our helpline at 1-855-885-1555. So please, if you are there, register. We can sort the rest of it out down the road. Thank you.
Shelley's now going to leave you with her final word.
As long as I have a mic, I've got your back, and no one's going to shut me up.